Okay, everybody. Here we are at the final video lecture for the psychological assessment and testing course. And what we are going to do today is I'm going to go through the whole concept of a full psychological assessment report. Um, I have one in front of me. Unfortunately, I could not. It's a thorough psychological assessment. Unfortunately, I could not provide you examples of it because all the identifying information is still in it, and it was a PDF, so I can't take things out. But what I'm going to do, sort of step by step, is talk about what is in a psychological assessment report. Now, this is a report that was the only thing about it is the report that I'm going off of is using the MPI, the MMPI-A. It was also using the TAT, but it was for a 16-year-old. So the MMPI-A has the same structure, the same scales as the MMPI-2. One thing you may have remembered that I mentioned uh, I think way back in the first class when I started talking about the MMPI 3, I was saying there is no replacement for the MMPI A. So even though there is a new MMPI coming out for adults, for teenagers and adolescents, it's the same. The MMPI will still be used. So I'm going to make reference to the MMPI A in here, but it's essentially just set up just like the MMPI-2. I use this because in the my testing over the past 10 years or so has largely been when it's been a full battery like this has been mostly with adolescents. I do consulting to a juvenile detention center. I also previously was consulting psychologist uh, to a residential treatment facility for teenagers. So, as you know, the TAT we can still use with teenagers and adults. But for the MMPI, there's an MMPI A that has the same scales as the MMPI 2. Okay, so for this individual, the question specifically had to do with level of cognitive functioning. So there are some cognitive tests in this, and level of social and emotional functioning. Um, I know we didn't get into cognitive tests here. I am going to make some mention of them, just because very often, if you are doing a full battery, you may be asked to do an IQ test if you are trained to do one. I know we didn't touch on that in this course, but and we did talk about the mini mental status examination. So I will be talking about some of the cognitive tests that are used here. The Wechsler adult intelligence scale you have to be trained on individually, but the other cognitive tests that I'm here, once you have a PhD, you can buy them and use the instruction manual to instruct on how to use them. So for this individual, I was asked to do assessment of cognitive strengths and weaknesses and level of social and emotional functioning. And this was for an individual who was in a juvenile detention center. And the question was, she kept getting in trouble. And the question was she not understanding rules and um, or did she not have the intellectual or cognitive ability to understand rules? And then the other was, or was it that she was emotionally unable or unwilling to follow rules? or was it a combination of all of the above? I know we spent actually all of the class time, both the video lecture and most of the live lecture, on the mental status examination. And that's because I do want you to have an understanding of it, of cognitive assessment here, although this was not a cognitive assessment course, because it's probably a false distinction to make it seem that you will never do that. I mean, very often you will be asked to make the question will come up, like I said, as came up with this individual. Was she unable to understand the rules, or was she unwilling to follow them? Was it more of an intellectual cognitive deficit, or uh, was it an emotional, psychological problem in terms of her ability to follow? So now, very often, what you will do is you will start a psychological assessment by specifying the referral question. And as I said, specifically for this assessment, it was requested to identify possible sources of the individual's um, disciplinary and legal problems, because she kept getting in trouble. She kept getting into disciplinary problems at school and out in the community. And I was being asked to make treatment and or school accommodation recommendations. So that's why I was being asked to assess her level of cognitive functioning and level of social and emotional functioning. So you would start very often with the specific referral question. You would start with a specific statement about why are you being asked to see this individual. And then second would be identifying information, and that would be some aspects of the identifying information would be to talk about the individual's age and educational background, where you saw them at. So in this case, saw the individual in a juvenile detention center. Um, what is their history? Do they have a history of problems? So in this case, this was an individual with a history of anger management problems and disciplinary problems at school. You would want to, uh, like I said, specifically say where the individual was seen at. And then the next section would be relevant history. And some aspects of history that are particularly relevant for a psychological assessment would be where were they raised? Was there any information? You want to start kind of back at the beginning, actually. You want to start with, is there any information about the individual's birth? Was there any indication of um, prenatal difficulties? Was there any problems with the mother's pregnancy or delivery? Were there any was there any evidence of prenatal trauma? Any evidence of there being physical violence or drug use prior to the individual being birthed? So you want to see if you can gather any information about prenatal or uh, problems at delivery or just after birth. Because as we've seen, when we talk about some of the, well, we didn't talk about it so much in this class, but in the if you've had a diagnostic test or a diagnostic class on diagnosis, you'll remember that there are several diagnoses that are considered to be lifelong, that are considered to be present since birth, like, well, particularly autism, but also ADHD is considered to be a neurological condition, which would suggest that it has been that it is something that is evident throughout the person's life. So you want to start with prenatal. Is there any information about prenatal difficulties? And then you want to talk about where the child was raised, you know, where they spent their childhood, who raised them, parents together, uh, divorced, if they are divorced, when were they divorced, any evidence of domestic violence, any evidence of either of the parents having medical or psychiatric problems. You also want to look at psychiatric problems in the extended family, because a lot of um, because there is a lot of evidence of genetic predisposition playing a role. And one of the things I'm going to do here as I talk about the assessment, as you can already tell, is I'm going to talk about specifically what you cover, but I'm going to try as much as I can to get into detail about why you cover it, why it's important, what you're looking for. So prenatally, you look at, is there any information about this individual have been exposed to prenatal trauma? And then you want to look at the major events of their childhood, including parental separation and divorce. How old were they when the parents separated? How old was the individual when the parents divorced? Did they live with anybody else? Did they live with another family member for any period of time? And if so, why? Um, when is there any evidence of developmental delays? Did they meet developmental milestones at the expected time? Um, and so you know, you want to know about when they walked and talked primarily. When did they start school? Did they go to preschool or nursery school? Um, when did they start? If you are seeing someone for um, behavioral issues or mood issues, when did those mood issues or behavioral issues first become apparent? You want to try to have a sense of, you know, and as I said, this individual is a 16-year-old. Uh, but even for adults, you want to know, when did you start to show these difficulties? If it's a mood problem, when do you first remember um, having emotional difficulties? When's the first time you remember anybody describing you as depressed? In this case, it was behavior problems. And for this individual, behavior problems started interfering with her academic performance when she was in the third grade. But you want to get a background about when the mood and or behavior problems started. You want to get information about the individual's um, the individual's um, uh, psychoeducational um, level. And one word, I don't know that we talked about this, one phrase that I think is used in every state that you want to keep a lookout for is called an IEP. Yeah, in fact, it is used in every state. An IEP. Oh, yeah. I'm just looking at this other material. I have another report up here that I'm using from somebody else. And actually, I'm going to focus more on this one. I didn't realize this when I pulled up this colleague's report that I was using, but this individual was in California. So since that's where you all are, I'm going to focus on this one. I was kind of going back and forth between that. I didn't recognize that part. Um, so I had my assessment I'm going to go back to, but the main one I'm going to be using now is also for a 16-year-old. It's for a similar situation, but this individual was evaluated in California. Uh, it's a it's a report someone let me use for this. But they mention IEP here. So IEP, when you are evaluating somebody and you get to the point where you talk to them about their educational history, you want to look for words like IEP. IEP is individualized education um, program, and it is the formal documentation that someone has to have when they get special support services in school. So in this case, this individual received an IEP specifically for ADHD. Now, when you hear about somebody getting an IEP, you want to know as much as you can about why they received the IEP and what the diagnosis was that was used to justify the IEP. IEPs are specifically used for um, or can specifically address four different types of services: behavioral or emotional support services, um, uh, learning support services. So when the problem's more academic than behavioral or emotional, autistic support services, specifically for an individual who is diagnosed with autism. And then IEP is also the formal documentation used for gifted programs. So if somebody is of a high IQ, then they might have an IEP, which is specifically called a GIEP, a gifted intellectual education programs. You also want to look for uh, the term 504 plan. And a 504 plan is um, less formal than an IEP. So it's for accommodations and not for specialized services. So it's just it's when someone's not bad enough that they qualify for an IEP, but they have problems and they need special accommodations in the school. So if you're talking to someone about their educational background, you want to ask about an IEP or a 504. And if they know if they had an IEP or 504, you want to find out why and what diagnosis was used for it. You want to find out the different types of schools they went to. Were they public school throughout? Were they private schools, Catholic schools at any point? This individual started off at a private, religiously um, affiliated school, and up until the fifth grade, and then started attending public schools. Um, Disciplinary problems started in third grade and started and contributed to behavior problems, contributed to academic problems in the third grade, and it got so bad that she was failing um, when she was failing classes when she was in the 10th grade. Okay, so you want to know about the education. You want to know about occupational history. Have they ever had a job, and if they have had jobs, how long have they held them, and have they ever been fired? You want to find out about legal history. Ever been arrested? This individual had never been arrested up until being in the juvenile detention center after being arrested for destruction of property. But the police knew her because she'd been in trouble several times before. So you want to ask when you ask about legal history, you want to ask not just about arrest, but have they ever been involved with the police? Have the police ever contacted them? Has the police ever been to their house? Um, DUIs are an important thing to ask about because sometimes people will say they've never been in trouble with the law and forget that that would include a DUI. And if they've had DUIs, you want to ask how many. And then that also segues into another issue you want to talk about, which is drug and alcohol problems. I will really try to encourage people or really emphasize when I'm there when I'm talking about drug and alcohol problems, I will really try to emphasize that I am talking if it's an adult, if it's someone over 21, I will really emphasize I'm talking about heavy drinking or if they think they have an alcohol abuse problem. Um, I try to make clear if someone seems apprehensive about admitting that they drink at all, um, or smoke marijuana at all. I will really make sure they know that that's not what I'm asking about. I'm asking about if they have a problem, if they use it on a daily basis, on a regular basis, if they've ever tried to quit and had problems with quitting. Um, just to help people get up because they'll get worried, that you're gonna, if they mention anything about drinking, that you're gonna think badly of them. And of course, drinking alcohol is legal, so they're not marijuana is that's a more iffy. But even there, if you're really looking for abuse problems. I also encourage people, when I ask about family psychiatric history, I will encourage them to realize that I'm talking about formally diagnosed and treated psychiatric history. If they want to start off by saying, well, my mother's crazy and here's why, that's fine. But you also want to get a sense of whether that quote unquote craziness is ever translated into formal diagnosis and or treatment. Okay. You know, depending on age, this is not relevant here, but you want to ask about children. Do they have any children? Uh, have they ever been married in a serious relationship? Um, and if they have children, how old? Um, uh, are their children diagnosed with any sort of learning disability, any sort of psychiatric problems? You want to also just get a general sense of uh, whether they think their relationship with their children is good. Do they share custody with the parent? One other thing that I will ask about, because it's something that people will not necessarily associate with legal issues, is you want to ask if the children and youth services have ever been involved. Have the child authorities ever been called on them? So that's the part of, so that's relevant history. Next thing that I often list is the information sources. And this would include what records you reviewed, who you had an interview with, and what sort of tests that you used. So in this case, I did an interview with the teenager. Parents weren't involved. This was ordered by the court, so it was not a requirement for me to get background from the parents. Um, uh, but I did interview the probation officer. So there was an interview with the woman. I'm going to call her Sally. Um, uh, Sally was uh, I interviewed her at the juvenile detention center, and I interviewed her um, her um, probation officer, and found out from the probation officer that part of the reason I couldn't interview the parents is they were tired of Sally. They couldn't put up with her anymore. Tests I administered. I did administer the Wechsler Intelligence Scale for Children, and I'll make a brief reference to that. Some of the cognitive tests that I used, and these aren't the mini mental that I talked about before, but I used what is called the Bender Gestalt and the Behavior Rating Inventory of Executive Functioning, and I will talk about that. One thing that is particularly interesting about this, and I thought was worth bringing up, is I use not only the MMPIA and the thematic apperception test, but also the house tree person test. So the MMPI2, the TAT, and the house tree person test. And I know we discussed that in class. Okay. Um, Next section, I will often split it up into two sections. I will split it up into mental status examination, and behavioral observation. Some people some people include the behavioral intervention observations just under the, well, they include the behavioral observations under the mental status examination. I include them separately, especially for teenagers or somebody I'm using. Uh, um, Typically, I will do that for a forensic evaluation. If I'm doing it for the court, I will include, or if I'm doing it for a teenager, I will use the mental status examination and the behavioral observations. If it's an individual where the behavioral observations don't really stand out, um, I might just in the mental status examination make a few additional comments about their attitude towards testing, whether they were cooperative, whether they seem to have any problems. If there's anything about the behavior that stands out, as far as, the person may be being seen for anger management problems or attention problems, I will make, even for adults, I will make behavioral observations a separate section. So you already know about the mental status examination. I did that. I told you about that last time. The only difference here would be that if it's an adult, if it's a full battery test and it's an adult, and I did the mini mental status examination, I will include that in a separate section on cognitive functioning, which is in this case where I would put the intelligence testing results and the cognitive testing results, which would have been that test of executive functioning and the Bender Gestalt, which I will talk briefly about. Under behavioral observations, behaviors we're looking for, how is the person dressed and how is their hygiene? You want to pay careful attention to that. It's not that you're making a judgment about clothing or anything, but you want to see, did they look disheveled? Did they look like, you know, um, did they look like they were um, uh, did they look like they spent any time taking care of their hygiene and picking out their clothing, or did it look, are they looking disheveled? You want to look for that because that could be an indication of some um, psychiatric disturbance. Now, over the past year, almost all my evaluations have been via video, so you have to give a little bit more room for people not um, maybe getting as dressed up, or not that they always get dressed up, but not taking as much concern about their appearance because they're at home and you're evaluating them in their home as opposed to coming to an office. But you want to look for hygiene, clothing. Does it look disheveled? Does it seem appropriate? I mean, were they wearing shorts and a tank top and it's 42 degrees outside? Um, do they look their stated age? Um, was their speech um, clear, and if was there anything remarkable about their speech? So it's kind of taking the speech part of the mental status examination and maybe a little bit more. What I will make referral to in the behavioral observations is, if it was difficult to understand them, did they seem to recognize that you were having any difficulties? If you couldn't understand what they were saying, did they acknowledge that? If they were, if you pointed out multiple times that you needed more information, did they acknowledge readily that that was an issue, or did they seem to not recognize that they were being too brief with their responses? Any noteworthy mannerisms? What was the eye contact like? Did they start to become aggressive or impulsive during the interview? Did they show signs of irritability at different times? So you notice how the behavioral observations um, might go above and beyond. I will tell you that if I had to pick one of the reasons why I have the behavioral observations in a separate section, is it's where I could put more detail regarding behaviors that are particularly relevant. And what I particularly have it there is to sort of address my observation of the behaviors that are likely related to the referral question. So, for instance, in this case, one of the questions was, or the main question was, is this person's difficulties, is this teenager's difficulties more related to a problem with understanding, or is it more related to a problem with psychological and or emotional functioning? And so I will look for that as far as behavior clues when I meet with the person. Did they seem to get angry quite quickly? Did they seem to get irritated when I couldn't understand what they were saying? Or did they seem to just not recognize that there was any difficulty in what they were saying, that you were having, that there would be any reason that you would have a problem understanding what they were saying. Um, did they seem, in this case, like I said, this person was, um, had evidence of getting into trouble for breaking rules. So did the individual seem to not care about what rules you were setting for the evaluation and things that they were being told to do? Did they follow the rules that you gave for the evaluation? So if it's anger, you're looking for if there's any evidence of anger building. So, like I said, one of the reasons I include behavioral observations as a separate section in most forensic reports that I write, and probably the majority of reports I write in general, is because the behavioral observations give you a chance to to talk about what you see in the in how the person acts when you meet with them? And do you see any behavioral issues that would be consistent with the concerns reflected in the referral question? So, and ADHD should be another one. I think I told you at the beginning of the class, ADHD is probably one where the behavioral approaches stand out the most to me because I've done disability evaluations with people who are seeking disability for ADHD, and they'll come in and say, I'll ask them what sort of problems they're having. They say, "Oh, I can't focus on anything for more than 15 minutes at a time." Meanwhile, I meet with them for an hour and they got no problems focusing. So, it gives me that chance to take the things that are being reported about the person and talk about whether I see them or not, or whether what I'm observing seems to be consistent with what's being reported. You also want to make remarks about how the person responded um, when there were any sort of when they ran into any sort of difficulties. Okay, and then I'll move into the test results section. And in this case, it was split into different sections. There was a section on validity. The MMPIA has a validity scale. The Bender also has a validity scale. Um, and then you also can make a remark on something like the TAT or the sentence completion, whether they seem to be putting effort into their responses. And uh, and so in this case, uh, there was basically no it was valid. It was there was nothing on the MMPI-2. There was nothing on the Bender Gestalt. There was nothing in how she responded to any of the projective tests that suggested she wasn't putting sufficient effort into her responses. The validity, you want to give weight to the MMPI-2 validity scales, but you also want to. I mean, the Bender Gestalt validity measure is not as detailed as the MMPI-2. Um, but um, you want to, when you're talking about validity, you want to see whether there was anything in how you saw them perform on the test and the effort that they put into to the test that would cause you to question the validity and how much effort they were putting in the response. So like I said, you want to give stronger weight to the validity scales of the MMPI-2, but you also want to just take note of whether you observed anything during the testing that would make you think that there's a problem with validity. Okay, cognitive function. I'll just go through this real quick because it's going to talk about tests that we haven't talked about in class. Uh, Bender Gestalt showed no evidence of neurological impairment. Um, Average IQ. Bottom line was average IQ. Um, Average on all the tests of the Wechsler. Average the intelligence scale. IQ average across the board. Uh, the executive functioning. The executive functioning test. It's basically a checklist of well, it's a checklist and uh, tasks. So this executive functioning test is and it's the let me remind myself what the formal name of the test is. It is the behavior rating inventory of executive functioning, and it is a test of the person's ability. You know, there are tasks and it's a checklist, but it executive functioning includes behavior regulation, the ability to regulate your behavior. So this is why it would directly relate to the problems that this teenager was having, that Sally was having, because um, behavior regulation is concerned in the executive function. Executive function is sort of a higher level of functioning in our brain. So this is a good thing. I mean, it's a good test that if you're going to give a cognitive test, it's a good test to have the brief rating inventory of executive functioning. And it includes behavior regulation, the ability to regulate your behavior, not problems with behavior regulation or emotion regulation. There's between emotion regulation and behavior regulation. Emotion regulation is when you can't control your anger or your anxiety, and that's considered more of an emotional difficulty. Behavior regulation is considered more of a neurological difficulty. It's an inability to regulate your behavior. Behavior initiation is another problem that's considered to be an executive functioning. That's the ability to um, initiate behavior, to start behavior, to get started doing something. Um, and then organization is also considered to be a number, is also considered to be an executive functioning. The ability to regulate behaviors, um, the flexibility is concerned about the ability to shift from one task to another. So flexibility is concerned. So the executive function is a good cognitive section to have. And then you also would pull the when you're talking about cognitive function, you would also pull off uh, the perceptual organization and the cognitive aspects of the TAT. So you would talk about uh, the um, the sections of the T. Uh, sorry, the sections of the TAT that would talk about the person's ability to organize incoming material, um, to uh, to piece it together and to respond to different aspects. So you would take the first couple sections of Taglesi's um, uh, 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 assessment protocol, and with the cognitive processing material, you would include that under cognitive functioning. Okay, and then we would go to uh, the emotional functioning, uh, more of the psychological um, part. And this would be the most of the TAT and the MMPI2, the MMPIA, and the sentence completion. And for this section, um, uh, I have a section on a subsection on emotional functioning, um, self concept that comes more from the sentence completion, interpersonal functioning, and social functioning. So with the emotional functioning, um, that would be from the MMPI. So you would talk there about evidence of depression, anxiety, all the clinical scales, and a lot of the supplemental scales. So emotional functioning, um, and I mean, I'm just going to, you can sort of identify from the talks we've had about the MMPI and the TAT, what goes where. So in this case, it's emotional functioning, um, self concept, interpersonal functioning, and social um, functioning. And like I said, self concept, that's one that would, I'm sorry, not the sentence completion was there. Uh, and the interpersonal function, that would be the house tree person. So we didn't get a self concept, would be more the sentence completion, which I may or may not have mentioned. I had her finish complete as well. And interpersonal functioning, house tree person was there. So for this section, this section on psychological functioning, actually, I'm sorry, this is the other person's test. They called it socio emotional functioning. I call it psychological functioning to distinguish it from the cognitive functioning test. But this had the MMPIA, the TAT, the house tree person, and the Rorschach. I'm sorry, and the house tree person and the sentence completion. So, and then the results were split into emotional functioning, self concept, interpersonal functioning, and social functioning. You can tell from the things we've talked about, you can make your own decision what would go where from the MMPI. Different parts of the MMPI and the TAT would go under each section. But just to let you know, um, the self concept, much of the sentence completion would be under self concept, and interpersonal functioning, much of the house tree person would be under there. So, and then you move into summary and conclusions. And the way you address that is typically you would have one paragraph each of uh, cognitive development, um, I'm sorry, intellectual functioning, executive functioning, and social economic. So in this case, each of the main areas that were tested has like their own paragraph summarizing everything. And then it would start with a paragraph about the individual's behavior, the validity of the performance, and if anything stood out about the behavior. So the first one would be a summary of the behavioral observations, mental status examination. Then there would be a paragraph each, just summarizing each of the different sections that you covered in the testing, and then you would draw a conclusion about the person's um, clinical status. And I realized as I move on that maybe what I should do is just tell you a little bit about what was summed up for Sally in this report. So when they got to the part about cognitive development, it was basically um, uh, that is basically a summation saying she was average across the board intellectually. She did show on one of the testing some difficulty with uh, visual discrimination and mental construction. So there were some cognitive tasks that caused her difficulty, but the way the one test was developed, the executive function one, if she was given additional time, um, actually this would have come from the IQ testing. If she was given additional time, she usually did okay. So the cognitive, I'm sorry, that would be the cognitive function. So the cognitive uh, functioning was mainly based on the IQ testing. It did show that some difficulty with visual discrimination and mental construction, but which are just being able to handle visual material. But what it showed is even if she did have any sort of cognitive intellectual difficulty, she was usually able to compensate for it if given extra time or given a little bit more structure and explanation to the task. When it came to executive functioning, she did show problems with organization, um, sustained attention, and problem solving, which are all considered to be. So basically, her executive functioning um, was a difficulty for her. So she had difficulty with some higher level cognitive tasks. And what tended to happen is when tasks became, um, when she was confronted with tasks that sort of tapped into that difficulty, then she would become overwhelmed and start to get more disorganized. I bring up the thing with executive functioning because even if you have the first one, the cognitive development, that's I have it in there because if you have an IQ test, you want to incorporate it. And we didn't cover IQ, but if you have the opportunity to be trained on an IQ test and you're able to give it, um, that can be an important thing to include. Executive function I put in there because that's kind of a even if you give just like a mini mental status examination, you can get the sense of um, and you may want to give other cognitive tests, like for instance that brief the behavioral rating inventory of executive functioning. Um, you don't have to uh, you have to be specially trained on that. You can use instruction, but it's a good thing to have it. It talks about because what allows you to see is how much of higher level functioning causes problems for this individual. And um, so you want to um, if you have the chance to get that, it shows how much the person's likely to be able to handle before they start to get overwhelmed. Now, going back to the cognitive one, um, there were no problems from the TAT with her ability to process information. So, any difficulty with um, processing cognitive material, that was all from the IQ test. So, as far as the TAT goes, there were no problems reflected as far as cognitive functioning. The executive functioning did show some difficulties with higher level tasks. And then, as far as the social and emotional issues, things that were pointed out was there was evidence of depression, low level depression. So it was just over 65 on the MMPI2. Poor self concept, poor view of herself, pessimistic outlook, negative outcomes of efforts, especially when it came to social situations. So, from the TAT, showing a lot of evidence of just not thinking putting effort into social interactions were worth it. Antisocial ideas that came from the MMPI2, the TAT, the house tree person, and the sentence completion. So antisocial antisocial ideas due to anticipation of negative outcomes from her efforts. That was all four of the tests that were used for the psychological functioning. Um, she tends to avoid um, uh, social situations because she expects they're not going to meet her emotional needs anyway. Um, she feels that having to interact with other people and having to follow rules are a burden to her. And what was really particularly evident on the TAT was she tended to use some pretty violent fantasies in order to feel powerful and invulnerable. So what stood out from the TAT was how violent some of her stories was, like unnecessarily violent. I don't remember specifically what was in there, but I think it was one about like even on the farm with the girl on the farm. There was evidence that something violent had happened with the people in the background, that they were covering up some sort of murder. Just and some pretty violent fantasies that seemed to be a way that she would start to feel powerful and invulnerable. Okay, so basically, you sum up each of the major sections, and then you will follow with a summation, usually related to explaining your diagnosis. So in the summary part, you sort of talked about what the main issues are that have come up from the testing. You might include a paragraph if you thought there was anything noteworthy about your behavioral observations. I try to make it pretty straightforward, as does this other individual, just one paragraph for each of the major sections summarizing it, and then one sort of conclusion at the end that discusses my diagnostic impression. In this case, uh, there was evidence. There was evidence of her having depression, and when it was um, looked into, uh, compared to her history, it seemed like it seemed like the depression. There was evidence that depression had been there for years. And again, this is how all this ties together. MMPI-2 shows depression. History shows that whatever emotional difficulty she's having now, it's been there for a long time. And the TAT and the other projective tests show sort of these interpersonal difficulties that have been there all her life that contribute to the depression. So you kind of tie it all together. Depression, history shows been there a long time. Test results shows she's got this negative response to other people. Uh, and it comes out, this sort of emotional response, which is tied to the depression, comes out in some pretty negative behaviors and just not feeling there's any point in trying to follow social rules because she's not going to get anything out of it anyway. All of that would, so when it comes to the diagnosis for that's lower level depression that's been around for years, this was a um, the of course the diagnostic manual for mental health diagnosis is the DSM. We are now in the DSM 5. This was done using the DSM 4. So the DSM 4 diagnosis at the time for a low level depression that's kind of present for years is called dysthymic disorder. It is now called persistent depressive disorder. So now this would be persistent depressive disorder. And then the cognitive test, the difficulties that this individual had with organization, functioning, kind of responding quickly when overwhelmed by too much information, getting overwhelmed quickly by too much information, and then just sort of giving up when there was too much information. All of that was consistent with ADHD. Okay, and so if you look at then, and then the next section would be, so there'd be a clinical, uh, I call it clinical impressions. So there'd be a summary, and then clinical impressions, which I just talked about. And then there would be just a section of diagnostic impression, in this case, dysthymic disorder, which would now be persistent depressive disorder and ADHD. Um, and then treatment recommendations, or general recommendations. In this case, for the ADHD, IEP was recommended, beyond what she already had, and medication evaluation for ADHD. Um, Psychotherapy with a specific recommendation uh, for what was called interpersonal psychotherapy, which is a type of psychotherapy really focused on helping the individual develop skills to be more connected with other people. As far as addressing some of her behavioral issues at school, um, uh, a suggestion was made for more structure at home or at school, and there were specific recommendations for more structure. The idea being that if she knew specifically what was expected of her, she might have a tendency to be less frustrated. Because remember, even in the TAT, what's reflected is she basically gives up because she sees it's not worth it. She doesn't see the benefit to it. And so, if things could be broken down into more structured activities, both for what's expected of her socially and in terms of following rules, she might be more consistent in um, following them. And then there was a recommendation to get her involved in more structured social activities that also involved physical activity as a way of kind of burning off the ADHD energy. And there was specific recommendation that as much as possible, they be physical activity that are social so as to help her develop more of a sense of there being a benefit to social interaction. So a lot of the recommendations have to do with getting her to both learn skills to get more out of social interactions and to feel more connected with people and more structured activities so she also would feel more of a benefit, more of a purpose to even trying to connect with other people and follow social rules and social norms. And that's it. That's the recommendation section. That's the whole report there. We've looks like we've gone about an hour, so I'll stop here. And if you have any questions, post them in the discussion board or bring them up at class on Thursday. I'll see you on Thursday.